Good morning, everyone. Thank you for joining Encore Palm Beach County for our special monthly Zoom event. Today, our special guests are Melissa Morante from ComForCare and Eleni Francis, a recruiter, and they will introduce themselves. Melissa, it's all yours.
Thank you so much. Good afternoon, everybody. Thank you for having us. Like Christine said, I am Melissa Morante. I, along with my parents, my sister, my brother-in-law, own and operate ComForCare Senior Services. We are a private duty, non-medical home care agency. So what that means is we provide care for people in their homes. And as some of you may know, in your home in the state of Florida is where you live. And that can be your private home, that can be your independent living apartment, that can be your assisted living apartment, your memory care unit. We also provide, we call it sitter services. I don't really like that term, but sitter services in hospitals or rehabs as folks are recovering before they transition back home. The people that provide the care are home health aides or certified nursing assistants. Those are the licenses and certifications that they hold. And so we primarily assist with activities of daily living, bathing, dressing, feeding, transferring, toileting. And then we also assist with what we call instrumental activities of daily living. And those are things like meal preparation, laundry, light housekeeping, running errands, reminding folks to take their medications, cleaning up after a meal, changing the bed linens, those kinds of services. Clients dictate when they want the services. So we have some minimums in place, but typically clients decide how much care they need. We can certainly help figure out what makes the most sense, but they dictate the schedule. And then our schedulers work to make the match. And believe it or not, there is a little bit of science behind that. And so taking into account personalities and needs and skill sets, our schedulers have a really, really, really good understanding of how to make that match. In fact, some of our schedulers were once caregivers, and so they really do understand that. Look, it's not a secret, right, that the need for care, right, is far exceeding our ability to provide that care for a whole host of reasons. One, we need more people to do the work, right? Costs are certainly a factor. And I don't want to get political. That is not my MO, but the truth of the matter is the government understands the needs, but we just don't have the resources, right, to do that. There is a new program actually for the first time, CMS, the Center for Medicare and Medicaid Services, is providing a $2,500 stipend, for lack of a better word, that will pay for respite care for anybody who is on traditional Medicare, so Part A and Part B, traditional Medicare. If you are mid to late stage of any form of dementia, you have to qualify. There's an assessment, but Medicare will reimburse or pay for up to $2,500 for respite care. For those that don't know what respite care is, that is when a caregiver like ComForCare provides comes into the house to give the family caregiver a break. And that's what respite care is. So that's a wonderful program. It's brand new. And so that's very exciting. The other things at play, people want to age in place, right? They want to stay home as long as they can. Of course, when safety becomes a concern, sometimes staying home isn't always the best option. And so we're fortunate to live here in South Florida, where there are some beautiful communities that folks can move into. And if they need some supplemental care, like I mentioned earlier, that is something that caregivers do provide. I think how mature workers fit into this space. This is a great opportunity for those who have retired and are looking to re-enter the workplace, whether that's new, whether that's, they've been out of the workplace for a while and are looking to re-enter, or they're just looking to make a change. And so, like I mentioned, we are primarily home health aide or certified nursing assistant care, but we do also provide companion care, and that's a little bit of a different service. So companions are exactly what it sounds like, right? They're there to provide socialization, engagement, companionship. They can help with running errands, transportation, taking to doctor's appointments. Sometimes companions will help with laundry or some meal preparation, but it really is primarily just socialization. And here's what we know post-COVID, right? Isolation among seniors is very, very real. And then when you layer on something like a chronic illness, right, which is in and of itself isolating, the isolation becomes even more. And so that's where companionship really is so beneficial and really can change the course of someone's day. And so I think what might make the most sense at this point is I'm going to turn it over to Eleni. She's our director of recruiting. She also does scheduling for us. So she is a wealth of information to talk a little bit about what those requirements might look like for somebody who is interested in perhaps joining our organization as either a home health aide or a companion.
Hello, as Melissa said, my name is Eleni. I've been here with the company for about 3 years. I started off scheduling and I have moved my way into recruitment. So like she said, I know it from both sides. I know what we're looking for, and I'm looking for those people out in the community. We do have a bit of a list of requirements, but it's nothing unattainable. It's something I can help everybody with. A few of the things would be your CPR, getting a home health aide badge in Palm Beach County, because you cannot work without one of those. It just allows people in the community to know that you've had a background check and that you're safe to come to their home, because that can be scary to have somebody new come into your home and not know much about them. We also require that you have a physical and a TB test, because we are working with the vulnerable. We also ask that you have some certificates so you know what kind of things you're working with, like Alzheimer's, OSHA, HIPAA. Just some of these things are just requirements we have to have. All of these things, like I said, are obtainable. I can show you where to get them and how to get them. The biggest part, I think, is the money it does cost to get these. It can be anywhere between $100 and $200. I know that's a lot for somebody who's not working or is looking to get back into the field. Unfortunately, that's something I can't change. The thing about it is what you have and what you don't have, that will be the cost. If you don't have the badge as of yet, it can be a little costly to have it. Unfortunately, like I said, in Palm Beach County, it's something you must have. Your fingerprints as well, that's another cost. You must have your fingerprints on file so we can do a level 2 background check. I am more than happy to help anybody get these documents. But first thing I ask is that you do call the office. And if you can't get a hold of me, our receptionist, Donna, is more than helpful, and she will take your information and I will get back with you. Obviously, I ask that you give me a little time because I am covering all 4 of our offices, plus I am doing scheduling in the meantime. It's not that I forgot about you, I just need time to get back with you. We do have companion clients as well. These costs are the same for companions. They need almost everything the HHA does except for the certification and a few of the certificates. But in the same instance, they are going into someone's home, so we do need these requirements. We do have clients that are looking for companions and HHAs. Sometimes the two are combined, but companions, like Melissa said, are there really to just socialize, get them out of the house, and make them feel good because they look forward to these visits once or twice a week. Um, the time for companions is very short. We get about 2 to 4 hours a week for these companions. So it's not going to give you many hours, but it does give you flexibility because companions are mostly open to change their schedule, especially if they know someone's coming and can help them and get them out and have a good time. It's important for them. Our HHAs, like I said, we are more based with the HHAs. And if you are one already, we can help you along in the process. If you are not one, we have a nurse who can competency you, which means she gives you a test and you'll need to pass it with an 80% or better. She can then sign you up for an HHA certification, but then you will also need those requirements behind it as well. She will only test you. She doesn't train you. So we ask that anybody who wants to become an HHA, that they do have some form of training or they have some kind of expertise in the field. Because we don't want to just throw anybody in there and they have to transfer somebody and then, we could have an issue. Otherwise, like I said, I am open and available to talk to anybody through the process. They have any questions, I'm more than happy to help anybody. And that's it.
So just two important points that Eleni mentioned that I just want to touch on for a second. So one is the HHA badge. So this was a new requirement that was effective in, I don't know, March of 2017, maybe-ish. It was a new ordinance that was passed in Palm Beach County. And the reason for the badge is to prevent somebody from, to prevent a vulnerable adult from being taken advantage of. So what was happening was, cleaning lady turned caregiver, right? That was not licensed, really didn't have the appropriate training, was taking care of vulnerable adults. And so there's risks associated with that. And so actually Scott, our CEO, was the only representative of a home care agency that participated in the writing of this ordinance. And it is strictly to protect our vulnerable population. And so what happens now is if somebody who is taking care of a vulnerable adult is seen without their badge, there is potential jail time and a $500 a day desk fine. So it is punishable by law if you are caring for a vulnerable adult and you do not have your Palm Beach County badge. Unfortunately, the same is not true in our other surrounding counties, but maybe one day we'll get there. So that is the reason for the badge. So while it seems like it's a lot, it actually really isn't that heavy a lift, but it is really quite necessary and for good reason. And then the other point is the competency test. So for those who are interested in getting their HHA certification, if you come to our office and we coordinate with our nurse to competency you and you go through the process and you obtain your HHA certification, that means if you get that through us, then you can only register to work with us. You would not be able to register with any other home care agency as an HHA if we competency you. If you already are an HHA and you're registered with other agencies, we more than welcome you to also register with us. Karen?
I have a question. Thank you for explaining all of that. So we have two areas that you're discussing. One is the HHA and then home health aid. The other is the companion care. And I know you said right now the need for HHA is a little bit more than companion care, but somebody could, who's thinking about this, maybe think about starting as a companion, even though there's not a lot of hours available at this time, to kind of get their feet wet, see what they think, kind of seeing if they like it, and then potentially, could move into HHA if that's a true statement, I would think. want to mention that. And why do you feel that matures are so perfectly suited for this type of work? What would be the benefits of matures? And also, what would be the benefit for a mature person to want to do this and affiliate with hopefully ComForCare? What would be the trade-offs or the things that each group is respectively receiving? Thank you.
So I think the benefits for mature workers joining our workforce, right, or becoming a companion or a home health aide, there's a few, right? There's the giving back, right? The taking care of somebody who is having trouble taking care of themselves, right, in certain capacities. And so the ability to really improve the quality of someone's life is so meaningful and powerful. I also think it gives people a reason, people are expecting you to show up. And so if you don't, right, and heaven forbid something happens, somebody's going to call and look for you and come find you. So that's always a plus. I also think, on our side, right, hiring mature workers, there is a lot to be said for work ethic and commitment and loyalty and all of those things that come into play. And we hear all the time about how some of those traits are lacking in some of the younger members of our workforce, not ours, just in general, the workforce. And so those are certainly benefits to us. And I think, look, I think sort of seniors helping seniors, right? Matures helping matures is just, it's so nice. And there's some similarities and things that are sort of common between client companion, client caregiver, that would make for a really meaningful relationship.
Thank you.
Does that answer the question?
Yes, thank you.
Okay.
It's lots of great information you're sharing with us. So why would someone be interested in doing that aside from everything that you already said? Are there any other perks, so to speak, that would go along with the position?
So certainly flexibility in schedule is one. All of our caregivers and companions can make their own schedules. We are very proud to say that most of our home health aides and certified nursing assistants, just because there was more work, have worked for us full-time. Over 100 of our caregivers have worked for us full-time for over a year. That's a pretty astounding stat in this industry. The turnover rate in this industry is fairly high. And so we're very proud of the fact that people have been working for us full-time for such a long period of time. We like to think that that's a reflection of the type of place that we are and the environment and the culture that we sustain here. We have some other benefits for those caregivers who are also going to school. We have a fair amount that are in nursing school. We do offer tuition reimbursement. There's some requirements and parameters, they have to score a certain grade, but that's an incentive. We do offer a 401k, we offer referral bonuses, loyalty bonuses. We do a caregiver of the month every month. And so we believe in recognizing all of the great work that people are doing, because this is really great work. I mean, we really are improving the quality of life for our vulnerable adults. And so we're super proud of that.
Great. I see Lori has her hand up. Hi, Lori. You can unmute yourself and ask your question.
Hi. My I have to apologize because I missed the intro part. So I'm not really sure what you're looking for in a home health aide.
So home health aides, they assist with activities of daily living. So it does not mean that every client needs all of these services, but an HHA certification allows you to assist with bathing, dressing, feeding, transferring, toileting. And then in addition to that, HHAs help with what we call instrumental activities of daily living: meal preparation, laundry, light housekeeping, med reminders, taking folks to and from doctor's appointments, grocery shopping, nail appointments, hair appointments, running errands, whatever the case may be. And also companionship. So here's an interesting way to think of this, right? Home health aides can provide companionship in addition to all of the other things that they're allowed to do. The reverse is not true. Companions are not allowed to help with the activities of daily living. They really are there just for companionship and socialization.
Okay. And you talked about benefits. Do you also provide health insurance?
We do.
Okay. And what are the rates of pay?
We don't really discuss that publicly. So yeah, if you were interested, you can call the office, ask to speak with Eleni, and she'll go over all of those details with you.
Okay. Is your contact information somewhere?
We'll get it out to you, Lori.
All right. Thanks, Christine.
Mhm. Now, Melissa, you had mentioned the 2 to 4 hours a week. Was that just for the companion care? And is that for if someone is working with one client, or can they have more than one client in the course of a week?
Oh, yeah, they can have as many clients as they want in the course of a week. Typically, a companion client uses 2 to 4 hours of care a week.
Okay, and they can work as many hours as they want. Okay.
Sure.
There is no minimum number of hours, just
So for companion clients, the minimum is 2 hours per shift, but you can have just 1 shift a week. For HHA care, it's typically 4 to 5 hours, a minimum per day, no minimum days per week.
And is there any particular training for the companion care that they need for that?
I'll look for you now.
No, there's no training needed for companionship because, like we said, it's really just socialization, getting them out of the house, playing a game, take a walk in the park, take them for the beauty salon nails. So, no, really, the biggest requirement me to have a driver's license and auto insurance in a car.
And how well received are the companions with the family? How do you make that match?
So a lot of times I put the companion and I give them their number to the client because me calling and saying, oh, Jane Doe will be there tomorrow at, 10 to 12. It's better for them to call, introduce themselves. They'll talk to the client themselves, or they'll talk to a family member that's setting the services up for them. And that's how they build their rapport. They have a conversation. And if everything goes well, then they set up a schedule on their own, and it just goes from there. I just tell them to call me if they need me for anything, but really my companions, they take care of the clients that I never hear from them.
I know, because that's an important relationship, is for the family as well as for the client.
Absolutely.
Is there a particular age that you find is more interested in doing this type of work?
No, not at all. To be honest, I have as young as 21, as mature as 80. So to be honest, it really doesn't matter the age. I haven't found that to be an issue. Some of our HHA clientele, they look for more of a younger caregiver or mid to younger because they want to make sure they can lift and transfer them because they don't want the caregiver to hurt themselves. But really, age, it's never been an issue.
We like that. We like that. Okay, let's open it up to questions. Anyone else have questions? Not seeing any. Karen, do you have any other questions that you can think of?
Well, I just think the whole point that Melissa spoke about at the beginning in terms of there is definitely a mismatch between the need for caregivers and the number of caregivers. And I do give them very high kudos for their sustainability with their workforce, because like you said, turnover in this industry is high, but it is not at ComForCare because that relationship that the caregivers establish with the clients and the families is so important. So again, kudos to them for that. But I think in general, maybe if they want to talk a little bit about in a perfect world, are we short of caregivers in Palm Beach County? I know you have multiple locations, not just Palm Beach County now, Melissa. Maybe you could just talk a little bit about that. And, as people age in place, the need for care typically does not go down. So maybe you could just give us a little snapshot of what you're seeing as you survey the landscape in this regard.
So we definitely need more caregivers. But that said, I'm actually going to turn this one over to Eleni because one, she's our director of recruiting. And so she really is like feet on the street in terms of sort of what is going on and what we're seeing in terms of the caregiving situation. What I will say is sort of immediately after COVID, we were really struggling to recruit. But Eleni has made tremendous progress on bringing caregivers onto our team. And so I'm going to let her talk a little bit more about sort of what she's seeing and where we're seeing the most caregivers coming from, and then where we think we could use some more.
So we are definitely always in need of caregivers. We can't say that enough. But it's the type of caregiver we're looking for. We always want someone who's very compassionate and really wants to help. We don't want this to just be another job they have. We do see caregivers sign up for multiple agencies, so they're just looking for the next best job. That's not what we want. We want someone who's really going to step in and step up. I have caregivers who come in and get right on a case, and I never speak to them again because they're so great and it's just a perfect fit. Then I have caregivers that need a little more training, need a little more assistance. So we struggle with that as well. Our biggest areas of concern are Boca Raton and Jupiter, Florida. It is our biggest problem areas. We suffer there, but we have a large clientele there. So I'm always looking for people in close proximity, somebody in West Palm or somebody in Delray. But you'd be surprised that these people aren't willing to travel. They don't want to travel more than 5 or 10 minutes on the road to get to their client. They're looking for longer hours. They don't want to do just, 4 hours here, 4 hours there. They want 8 hours. They want 12 hours. They want 6 hours. So we struggle with that because we do have clients who maybe not need all of that care, but we can add on 2 4-hour shifts to make them 8 hours. But some caregivers are very picky. They want what they want. I'm falling into a lot of trouble with caregivers who don't drive, caregivers who struggle that English is their second language. So these are the things I'm seeing out there. And it's been more recently that we're seeing, those caregivers who have English as their second language, which can be an issue for us because, as you know, our clientele are, they can't hear as well, or they need someone to speak clearly and loud. But these caregivers, they want to work. It's not always the best fit. And we also are in Broward and Dade, and we are in Port St. Lucie, Martin County. We do well there. We don't have too much of a struggle, but we also are always in need of caregivers. So we're always open. We always invite everybody to call, apply, and then we go through the process and see if they're the right fit. But we're always in need of caregivers, always, always.
And we always hire, and we've always done this, by the way. This isn't sort of a new thing coming out of COVID. We always hire. We've never operated you know, where we just hire for a case. We always hire, we register people with us. So we have work. I think I want to just touch on the training for 1 second. So one of the things that we do offer, so 3 of our management team members, Allison, Tino, and Scott, are all nationally certified Alzheimer's educators. Tino is nationally certified is DOEA certified to teach level 1 and level 2. So what that means is he actually goes into assisted living communities and memory care units to train their staff on how to work with people who are living with Alzheimer's or other types of dementia. I am a Parkinson's care expert, and Allison and I are both trained the trainer, certified trained in Holocaust training. And so we provide those trainings to our caregivers and companions monthly. And so it is not clinical training, it's real life training, what you would expect to see in someone's house if they're living with Parkinson's disease, how the disease progresses. Tino talks a lot about recognizing triggers and redirecting behavior and understanding what it means to work with somebody who is living with Alzheimer's, or, like I said, another type of dementia. You know, and we do have a fairly large Holocaust clientele here. And so Allison and I train our caregivers on the importance of understanding things like being on time, the language that you use that could be a trigger, understanding what could happen if you take a Holocaust survivor to a doctor's appointment and they ask the caregiver to leave the room, why that could be troubling. And so we do offer those trainings, like I said, monthly to our staff.
Rosemary, you had a question?
Yes. Can you hear me?
Mhm.
Okay. I'm in a new location and I'm not sure how well everything is working for me in Zoom meetings yet. I have been in contact and know of Scott Greenberg for almost 8 years now, but how long has your agency been in business?
So the agency has been in business since 2008. Scott came in 2010. We're part of a national franchise. So he purchased 50% of an existing franchise. And then Allison and Tino came in 2012. I joined in 2016. And then about a year or so-ish ago, we purchased Broward and Dade.
Okay, so you're well established, because I think people want to know that they're working with an organization that's not here today and gone tomorrow kind of thing, because there is a lot of uncertainty out there in the work world. And and I don't think, as you said, I think it would be very hard for people to not realize that the need for caregiving, because of the increase in our older population here in Palm Beach County, and I read that more are coming every day to live here who will need care of some kind. On the other hand, we have a birth rate that's declining, so we're not producing potential workers of any age, really. And so there's a shortage of people. And what I'm hearing from you say, that there's a mismatch, it sounds like, between those people who want full-time work as a caregiver because they want that level income, and yet they aren't necessarily qualified for work at that level. Is that what you're seeing? Is that what you were saying?
Yes and no. Yes,
'Cause I-
yes, we have those caregivers who are looking for that full-time work just to have that income. But we also have caregivers who are looking for it that are they know what they're doing. They've been around for 20 years. That they've been working with one client, and then they lose that client, unfortunately, and then they're looking for someone to take care of for another, 20 years. So it can go both ways.
I have had people be in touch with me and Encore who are looking to be companions, uh, and are reluctant to get certification. Is it really that difficult to go for certification to be more than a companion?
I
I
wouldn't
think
say it's
sometimes people think it is.
a yes and no again. You would have to be up to the task. You'd have to be up to attend the school, and do the work and get the certificate. Or if you've been around and you do have the skills, we can have our nurse competency you, which takes no time at all. But it's really the level of training you need, which is going to determine how much work you need to put into it. And it really depends on how compassionate you are about it, how much you want to do it. But it's really not that hard. It's just the time you have to dedicate to it.
So would you suggest that people are unsure about things, begin as a companion and maybe graduate to becoming a certified caregiver?
Absolutely.
Okay. Because I'm just saying, based on my personal experience dealing with people who are always looking for work or something, people set up barriers sometimes themselves to getting what it is that they want. The other observation I'd just like to make, many, 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 many years ago, I'm talking 50 years ago, when I was working in Hartford, um, I remember that there were programs that local churches sponsored to encourage people to be visitors, to friendly visitors, to people who are shut in. Do you find that maybe the churches might be a good resource to find the kind of people you're looking for?
Yes, definitely. We have tried a little bit in the past. We haven't gotten much back from it, but yes, that has been something we've tried.
I think COVID and all that kind of put the fritz on things for a lot of the churches and their programs and so forth. It might be worth putting you know, a big effort into recruiting from churches. I also am aware that sometimes churches want the people to be volunteers for them, but they're not paying them, and so people who are companions, they do get paid, right?
Absolutely.
And is there how much of a difference? Not to quote pay rates, but is there a big difference between what a certified caregiver would get versus what a companion would receive?
Yes, because our certified caregivers, they have more of an opportunity to make a higher rate depending on certain cases. Companions are the same across the board. We don't have difficult companions because they wouldn't be a companion then. So our HHAs have the ability to make more because of the tasks they can do for each client. And like I said, the companions are pretty much the same across the board. So there isn't more opportunity as a companion. There's definitely more opportunity as a certified caregiver to make more.
Okay. At the beginning of the program, I mentioned that this meeting would be recorded. It would be saved on our YouTube channel and put in our next newsletter for people to share. I mean, we have 1,200 people on our newsletter, receiving our newsletter. Obviously, a lot of people do not tune in because they have conflicts of one kind or another, but we do our best to share your information. And I will probably, since I write the newsletter, I will probably be in touch with you to see if there's anything additional you would like to go into our newsletter. I would also like to remind people that your job board for ComForCare is on our website, along with all the other job boards from the various age-friendly employers that we have connected with. So people can get additional information there. I think that's it for me.
We've shared Melissa's contact information in the chat. So if you'd like to take that down, it's in the chat. And any other further questions? Does anyone have any questions? Comments?
I have a question, please. This is Karen again. I was hoping either of you, Melissa or Eleni, could touch a little bit upon the conversation or the comment that you spoke about. Well, you would want to have some background to go into the home health aide, to be competencied. In other words, to not have to go to the school and all of that. You said if somebody had some background. So the question that I wanted to ask is, if someone had been a family caregiver, perhaps a parent, a loved one, and had, let's say, fairly extensive experience in that regard, would that be the type of person who might be able to competency fairly quickly? Again, understanding there's certain requirements they would still must do, but might that be appropriate? Because someone might say, well, I haven't, ever done nursing, or I haven't been in the health field as a paid professional, but would that family caregiving give them a leg up, so to speak?
Yes, absolutely. Actually, I've hired many people who were family caregivers in the past, that weren't necessarily with an agency or being paid in that capacity. So yes, that is definitely an option, and we welcome it because those are the people we're looking for. They wanted to take care of their family, and now they want to pass it on and take care of somebody else's loved one.
Thank you.
That was a very good question, Karen, actually, because I think from my past experience, I actually had a companion agency many years ago, and that was my experience, is that the people that were looking to work with me and my clients, or people that had family members that they had lost, and they were looking to help other people because it's a wealth of experience they gain from having gone through that. So I think that's very valuable information. And I'm just sharing the information, Melissa's information again, so we can get that out. Okay, and make sure everyone has it. All right. We still have a few minutes left. If anyone has any additional questions that they'd like to ask, or comments, interests, concerns.
I'll just ask one last question.
Sure.
What about the need for male caregivers versus females? Anything exciting going on with that situation,
So we need
Eleni?
those male caregivers. Yes, that is another place we lack. Surprisingly, we are in need of male caregivers. It's a request. I can say we probably have a handful on staff, and they are already staffed out on permanent cases. So it's very rare that we can find a male caregiver, but we would be happy to have more.
That's a great question, Karen. Yes, we never think of them, do we? Okay.
How would you search for those people, those men? What do you do to find them?
So I do use the job boards, Indeed, ZipRecruiter. I use all of those to find them. But what I can tell you is our biggest referral source is through our current caregivers. So I do reach out to them. Do you have a cousin? Do you have a brother? Do you have an uncle? Somebody do you know that's looking to work in this field, or is working in this field, but just not with our agency, maybe with another? So I'm always looking for employee referrals. Those are our best ones.
Do you
Sharon
ever
has her
speak
hand up.
do you ever speak to men's groups?
No, I have not.
Sharon, you have a question?
Hi, yes, thank you. This is great information and I really appreciate it and having the opportunity to attend today. I wanted to ask, do you have a website? And if I missed it in the beginning, I do apologize, but do you have a website that we can go to and visit?
Yeah, sure. It's ComForCare. So COM like Mary, F like Frank, ORCARE.com/Palm Beach.
Could you repeat that so I can put it in the chat, Melissa?
Sure. ComForCare, ComForCare.com/Palm Beach.
Got it. Thank you.
And even if somebody was interested in the Martin County area or the Broward or Miami area, as you stated, they can still have access and contact with you through that.
Absolutely. And when all else fails, just call.
Yeah.
My dyslexic fingers spelled Palm wrong, but I think everyone knows how to spell Palm Beach. P-A-L-M.
Thank you. Thank you.
Thank you for your question. Anyone else? Melissa, how would you like to close us out?
Just say thank you all for your time. If this sounds interesting to you, or if you know of somebody who was not able to join, please reach out. And, again, if you have any other questions, if you just want to sort of talk through the process a little bit more, Eleni and I are here. We're happy to answer all of your questions. Please just reach out anytime.
Eleni, Melissa, thank you so much for joining us and sharing. This is a great opportunity for anyone considering a part-time job and additional income, especially the mature workers. It's a great opportunity for them. And we hope to share this information and get some of those people out to you. Thank you for sharing. Thank you everyone for joining us. Have a happy Wednesday.